Welcome, Attorney General Becerra. I want to talk to you about our nation's schools. About half of K through 12 students are still not spending any time in classrooms, with resulting losses in academic achievement, literacy, social and emotional development, not to mention the stress on their parents. Experts tell us that these extended absences are causing large learning problems, especially for lower-income students. In a recent op-ed in the Washington Post, two public health experts were critical of the new CDC school reopening guidelines. They suggested that while you need 6 feet for adults, that it is safe, if you have masks and other procedures, for students to only be kept 3 feet apart. It's not just these public health experts. The American Academy of Pediatrics has similarly said that schools should weigh the benefits of strict adherence to the 6 feet spacing rule with the potential downside if remote learning is the only alternative. So my question to you is this: won't maintaining this 6-foot recommendation, despite these very credible alternative views by healthcare experts, prevent many schools from resuming full-time in-person learning this year and possibly even into next year? And keep in mind, some of these students have not been in school since last March.
Senator, you posed the question that's on the mind of parents throughout this country every day. The preeminent concern must be the safety of our families. No one wants to risk the life of their child, and certainly no one wants to have a child become the reason an adult becomes ill from COVID. And so I will tell you what I believe is the best approach, and that is to let science guide us and let the experts determine when it is safe. Remembering that schools and education are a local issue, and where the federal government has a partnership, we provide the guidance. We should not be the ones making the final decision on how and when a school will reopen, because those are local decisions. But we must work with them and provide the guidance, the support, the resources to make sure that those schools do reopen as soon as possible and as safely as possible. So I can commit to you that I will work with you and leaders in Congress, but especially local leaders in our school districts, to make sure that we have provided the partnership they need to know when it's safe to reopen their schools for their kids.
Well, I would suggest that the American Academy of Pediatrics is suggesting the harm, these other public health experts, that we need to broaden who we're listening to. Let me, in my remaining time, switch to another issue. As chairman of the Senate Aging Committee, past chairman, I held the first congressional hearing on the impact of COVID on seniors living in nursing homes and other congregate care settings. And I've heard from numerous healthcare providers about the difficulty and expense of paying for additional staff and COVID-related facility improvements, PPE, et cetera. In my state, more than a dozen nursing homes have closed in the past 6 years, and many more are struggling to keep open. I was astonished that in a $1.9 trillion COVID package, the administration did not include any money for a provider relief fund, which would help these nursing homes. Do you support providing additional assistance to long-term care facilities, our rural hospitals, community health centers, and other providers?
Senator, thank you for the question, and I know how hard you've worked on these matters. I will tell you that I absolutely, I can tell you that as if I were fortunate to be confirmed, that it would be a top priority to make sure that we are providing the resources necessary. We've seen how so many of these assisted living facilities, nursing homes, and other facilities that care for aged and disabled Americans haven't had the resources. They're short on workers. And we've seen the crisis of COVID hit them hardest. And so we have to provide the help. And I believe it's important, and I believe President Biden will be there to provide the support, whether it's through the Provider Relief Fund or simply by making sure that we are providing resources that are already allocated to make sure that we're working closely with those facilities that have been hit the hardest.
Thank you. There's an excellent proposal in the package that 10 Republicans presented to the White House that I hope you'll take a close look at. Thank you, Thank you, Senator Burr. Senator Murray.
Thank you, Senator.
Thank you so much. We will turn to Senator Sanders.
Thank you, Madam Chair. And Mr. Attorney General, welcome. Let me start off by stating what you already know, that the United States is the only major country on earth not to guarantee health care to all people. Today, some 90 million Americans are either uninsured or underinsured. And despite that, we are spending twice as much per capita on health care as do the people of any other nation. And on top of that, we